Dr. Hoa Nguyen of the Governor's Physicians Advisory Group. Good morning, Doc. Thank you for joining us so late.
Hey, good morning, guys.
Gosh, you always sound so.
Well, I'm pretty sure you're in. You're
Are
in.
you tired? Are you all right?
No, it's okay, guys. We never get tired to fight this thing, so
That's right.
keep on going.
That's the spirit, Doctor. So, what kind of morning are you having?
Oh, very good. I'm in my clinic now, so we still have patient care to be with. So,
Right.
What about your night? How was last night's meeting?
last night meeting is very good. You know, we talk a lot about make sure we have enough test kits and try to go over some plan to start opening some business. So there are a lot of things to do.
What can you tell us about that recovery plan, Doc? Because they're not really telling us about it, and you're kind of like our guy on the inside. So what can you tell us?
You know, the governor have a lot of things on her plate, and the biggest part is to make sure that the recovery plan, we have to approach it in a matter of according to science, right? I mean, she's going to have a lot of people give her some data and all that kind of stuff, and we have to open the business, but in stage.
Mm-hmm.
You know, you have to make sure you open certain business, have certain guidelines for this to follow. No one going to go out and inspect them, but at least own a business so far, they submit their plan of how they open, how all the precautions they put in place in order to keep everyone safe. And public health and our committee, we review those and we give input for her, and then she has to make a determination which one to open and what stage, and we have to make sure that we have our ability to test to make sure that if they have an outbreak or something that we can test, track and trace and isolate those people. So everything has to be in place before she makes her plan. But I think it's very soon. I mean, everyone wants this to be open, but again, we don't want to happen like on Hokkaido in Japan, that they open the business because a lot of pressure on the business side to open, and then they have a huge outbreak and they have to close back down.
How did they reopen though, Doc? Because I actually haven't got to Google that. But so did Hokkaido just do like a crazy, hey, we're open now, everybody come, or was it also in a way that we're trying to do gradual?
Yeah. Hokkaido, they have a very aggressive, shutdown plan, and they did. They shut it down for about 3 weeks or so, and everything kind of come down. And they decided to reopen again because of a lot of pressure in the economy. And once they open, they find out it's not truly the people that travel from out of the country to come into that area for vacation, but truly the local community, the spread. That's the one that gets in trouble in the second surge. It's not the people from the Chinese and everything that are coming into Hokkaido, but it's a Japanese surrounding area that come in on vacation that have a second surge. So we have to be kind of open. The virus still out there. We have a very low number of positive in the past 10 days or 2 weeks or so. But we don't let your guard down. We still need to practice our social distancing. We're supposed to wear masks wherever we go. And don't let our guard down. I tell you, it's still out there, and it will come up again if we put our guard down.
I think it's interesting to see how much effort is being put into talking about how we're going to reopen this economy. And there's an advisory group. There's all these people focused on let's get the economy, gradually back open. But yet I don't see the same effort when it comes to helping the thousands of people that are waiting in line for food. And
yeah, that's a big part. We really want to.
I mean, you guys can open it, but nobody's got money.
Yeah, that's the part. I don't know, the stimulus check and everything kind of fall far behind. And again, it's a big part is to get our community back to work again. So because people run out of money really quick, So
I think
there's some plan there, and I tell you. Everyone criticizes the government, but she can open it and they go bad. They're going to criticize her. She opened too late. So there's no right or wrong on her part. I mean, no one wants to be in her shoes because everyone wants certain thing. But again, if this thing come back up again, it's all on her responsibility. So, I'm very sure that she's gonna open very soon. She just has to approach it in a way that's safe for everybody and make sure that people have food on the table and they want to go back to work again in certain fashion.
Right, and so we know just through sources that there's a 10 a.m. meeting with the governor's business advisory group, and we're hearing that meeting involves the former governor Carl Gutierrez, that he's kind of been folded into the loop. So, glad to hear that, Doc. But with you looking at the national news, you got 21 states that have reopened with some type of loosening of the restrictions. I mean, you talk about pressure, and we had Dr. Cabrera on a couple hours ago, and he said, Chris, if we started today, we had a plan, we went back 14 days, he basically said that we would have met the criteria that's being discussed.
The four criteria.
Yeah, the four different criteria. So, I mean, from what he's saying, if we had a plan, we could reopen gradually starting today.
I think that, like I said, she have a business plan today, and I know that she's going to meet us on Thursday, on the PAC meeting. So, like I say, probably by this weekend or next week, I'm surprised that she won't be open. I'm pretty sure she will open business by next week already. I say the 4 point that we go from one stage to the next stage, we are there, So right now the last part, that the fourth one is the tracing, the tracking of the patient. That we talked about a lot about last night. Make sure that if they have a recurrence of the virus, that we have people are going to make sure they follow right away and trace on the contact. So it's that is the last one, and I think it's come together nicely this week. So, like I say, she will open the next 2 days. I'm not sure when, but
what are we looking at, Doc? Because I know you know. So, what types of non-essential businesses are we looking at being reopened gradually, incrementally first?
If I on top of my head, I think the number one thing is the restaurant we opened. I'm not sure who's going to go eat. It's going to be some 6 people in the table, and they have to do certain stuff like everyone had to be registered and everyone had to be checked for any type of symptoms before they come in. They had to wear a mask.
Sounds romantic.
I know.
Hey, throw me the salt.
So it's from quite a few places will be open. The only thing I can tell you is the gym is going to be not be open for a while. We have to. Okay,
can you confirm? I heard that there was a request, a recommendation made to the governor about reopening the gyms, and that was roundly rejected, right? What can you tell us about that?
Yeah, I mean the people can exercise outside in the park and the street and you have a lot of places you can exercise outdoor, but when you put people inside the gym in a confined space and people go work out and you have the limited number of people in there, and it's hard for the gym to be sanitized, every half an hour. People get infected in the gym. That's one of the highest risks of them all. So I think that as we open certain business, that's necessary for people to carry on their life right now, and we're going to track to see if we have a recurrence of virus or not. And and like it's going to be a week or two to see what the virus stay low, and if it does, then we can open more and more and more. You can't open everything at the same time. So,
what if we?
The biggest part is daycare. People need to get their kids in there to go back to work. So, we're going to open daycare, but we have to talk to them and make sure that the owner daycare are ready themselves. Because remember, most of the daycare workers, they are elderly people and they're older people. And, and kids are somewhat, most of them are mostly asymptomatic. So you don't want to get our elderly people get sick either. So it's a lot of things that you have to think about. So it's not that you say, we open that we're going to open right away.
Right. Yeah. I think we just keep saying reopen. People have in their mind like, God, just flick the switch, everybody out, let's go. But it's not going to be like that.
You know, in the recovery panel, is there different subcommittees that, you know, there's the health that is comprised of people from the child care, or is it just this one group that's making all the decisions without reaching out to those different segments in the business community?
We have different subgroups, just like in
there are. Okay.
We have subgroups to work out some issue, because when you put a lot of people in one group, and nothing going to get solved. We got to break down to a little group in order to come up with idea, and then we'll bring back up to the table.
Okay, Doc.
But I think that, you know, like I say, I mean, she have a lot on her plate, and I tell you, you know, it will be open by next week. I'm very surprised it doesn't, you know, because once we met that 4 criteria, yes, we will open. But
I think people understand that the governor has a lot on her plate, and she's got a really tough decisions to make.
I mean,
but there's also people out
there
that, you know, can't provide for their families. So
I think the people actually have it tougher than the governor. I think that's a safe thing to say.
But I tell you though, we really like to say thank you for everybody that followed the stay-home order. I think the reason that we have a so low of the viral count right now, it's a big hand for everybody. I think that this is why, you know, we can, you know, beat this curve, because of stay home, and people do follow that. So, you know, thank you very much for everybody to do their part, and that's how we get where we are right now.
Right. That's true.
So, you know, again, when you venture out, you know, keep the social distancing, you know, wear your mask, and, you know, wash your hands, and again, you know, protect your elderly in the family to keep them safe for now. Okay, we're looking, you know, for the next 2 months to be back somewhat to the normal level, and hopefully during the flu season, September, October, that we can just deal with the flu and not the flu and the coronavirus. So that's what we'll keep our finger crossed. Okay.
Okay.
Thank you, Doc.
You're welcome, guys.
Okay.
Be safe, okay?
You too.
Of course, Doctor. Wash your hands.
Thank you for everything you're doing.
Thank you. And again, Chris Sabrina, tell everyone thank you so much for staying home and abide by the law, okay? Okay.
Thank you. Bye. Take care.
Thank you, Doc. Okay. 9:19. Yeah, you know, thank you for staying home when you were supposed to stay home. Good morning. It's 9:19.
Yeah, even when they gradually reopen, you should, you know, go do what you're going to do, go where you're allowed to go, and then